Hi, my name is Tomoko Jensen-Otsu. I'm a veterinarian at Evolution Veterinary Specialist. So today we're talking about rapid breathing in dogs, what to do about it and when to worry about it. So there are normal reasons for dogs to have increased respiratory rate and effort. One of those times when it's normal is when they're exercising, when it's hot out, things along those lines would be normal. When we start to worry is when their respiratory rate and their respiratory effort are increased, especially when they're sleeping. And especially when that rate is over about 30 as a sleeping respiratory rate. It is important to recognize when the breathing is abnormal, because when it is abnormal, it is a good idea to have them checked out to see if there's any underlying causes. If your dog has any of those signs, that it is worth contacting your regular doc or going to the ER, and especially if they're having increased respiratory effort, they're having any colors changes like of their mucous membranes in their mouth as far as turning pale or blue. Those are all reasons to go to see your doctor or the emergency room. The other thing that sometimes dogs and cats will do is when they're in respiratory distress, they'll open mouth breathe, and that is definitely a problem. So heat stroke is something that can happen in the summertime. Dogs that have kind of a short nose conformation, like bulldogs and boxers and things like that, are more prone. But it essentially is an elevated temperature where they can't cool themselves down. In the worst case scenario, it can eventually cause organ dysfunction, but it does mean if they have heat stroke, they should go to their regular doc or to an ER for treatment to get that temperature back down to normal. So if you were concerned about your dog's breathing pattern at home, you can count the number of breaths per minute when they're sleeping, and usually we ideally want it to be about under 30. If it's higher than that, and especially if then when they're awake you're noticing that they're having effort when they're breathing, they're pushing really hard like on their abdomen or their chest, then that is a reason to bring them in. This concludes our section on rapid breathing, what it means and when to worry.